Good morning, everybody. You're very welcome to the Solstice Arts Centre in Navan in County Meath. I'm Catherine McGuigan. I'm the Chief Officer of Age Friendly Ireland in Meath County Council, and I'm delighted that we're here for the second series of our webinars in partnership with the WHO. We have an eclectic mix of speakers today, and I'm joined by our Cathaoirleach, Councillor Sean Drew, who's going to give the welcome address and opening remarks. Alice Corbett, our Regional Programme Manager in Age Friendly Ireland, and we'll be joined by Emer Coveney in Age Friendly Ireland, my colleague Pat Mclachlan from the Alzheimer Society, and Dr. Noel Mccarfrey from the Exwell Medical Program, as well as a ministerial address from Minister of State for Older People, Mary Butler, and also some input from Stephanie O'Keefe in Health and Wellbeing in the HSE. So a huge array of information today. We have a short time frame to do it in. So without further ado, I'm going to welcome our Cathaoirleach, Councillor Sean Drew, to give the opening remarks. Thank you, Cathaoirleach.
Thanks very much, Catherine. I'm speaking to you today as Cathaoirleach, or Mayor, of Meath County Council, which is the host local authority for the Age Friendly Ireland Shared Service. In Ireland, local government is responsible for over 100 services, many of which are in more traditional areas of roads, housing, planning and voter registration. In more recent times, however, the role of local government through their community departments in supporting the health and well-being of citizens has magnified. This work is particularly enhanced through programmes such as the Age Friendly Programme, Healthy Ireland and Active Travel. We are also responsible for networking of community and voluntary organisations through structures called public participation networks. These networks were established following the recent local government reform programme and aim to enhance the participation of the citizen in local decision making. The Age Friendly Programme is a fantastic conduit for engaging with older adults in communities across Ireland and connecting them into both local government services and broader public services. While focused on population ageing, the programme is closely aligned with other national policy agendas, such as climate action, Healthy Ireland and social inclusion. By way of example, the Meath Age Friendly Programme has delivered excellent initiatives with the Climate Action Office, including the craft-based Purists of Wisdom and the Growing Together Young and Old Gardening Initiative, both of which have potential for national scale-up. With reference to what you will hear from Pat Mclachlan in Alzheimer Society, Meath also brought an enhanced focus to their age-friendly walkability audit in the town of Athboy by looking at the built environment from the point of view of dementia. At political level, the age-friendly shared service has tremendous support from local and national elected members, as we recognise the value of listening to the citizen to shape and co-design the services we offer to them. Back in 2011, the Dublin Declaration on Age-Friendly Cities and Communities was developed on a collaborative basis by the World Health Organization, Age Friendly Ireland and the International Federation on Ageing. The Declaration expresses the clear and strong commitment of political leaders of cities and communities to strengthen and champion actions to make their communities more age-friendly and highlights the need for ongoing improvement across a range of interrelated areas of older people's lives. Mayors from all over the world, from my own County Meath to Mexico City, signed the Declaration and as such share a common goal. They are committing to actions that will improve the life of older people in their communities, empowering local citizens to remain active and independent for longer and supporting meaningful participation in the social and active life of their community. The Age Friendly Programme is particularly valuable in taking an integrated approach, working on a multi-sectoral basis to identify older people's needs and deliver a coordinated response. At the last webinar in November, the Healthy Age Friendly Homes Programme was presented. This is an excellent example of an integrated approach to service delivery, supporting the health of older adults in the context of housing. You will hear more today about some of the important policy-level approaches aligned to health services and community supports, and range of supports provided through organisations such as the Alzheimer Society of Ireland, the Exwell Medical Program, and the Sharjah Age Friendly Program. I hope you enjoy each of the speakers. We are very pleased here in County Meath to be able to share these examples with you. And on that note, I wish you an enjoyable session and to wish you all a very happy Christmas and New Year, and stay safe, everyone. Thank you.
I think you made a very interesting point there about the Dublin Declaration, particularly for our international participants. This programme has been underpinned by local elected support and elected representatives. So I want to take this opportunity to thank you and your 900 plus colleagues around the country who have helped us get to where we are today over the last decade. Thank you, Cearlach. Next, thank you for being online. And I meant to say at the start, we were delighted with the participation we got the last time from our international delegates across the world. And we do have our international dimension today through Sharjah, which we're really looking forward to hearing about. And we had over 200 delegates the last time from across 26 countries. So we hope that continues to grow, and particularly today with the domain being community support and health services, it's very, very pertinent to where we are in the world in today's current environment. So if you don't mind, I will jump to Dr. Stephanie O'Keefe. Dr. Stephanie is a National Director in the HSE over Integrated Operations and Strategic Planning. She is also a member of the Age Friendly Ireland Shared Service National Advisory Group and has been a fantastic supporter to the work we have done over the last 11 years. So we welcome now Dr. Stephanie O'Keefe.
Hello everybody, and thank you Catherine, Minister, Councillor and attendees. I'm delighted to be able to speak today about the significance of the connection between local authority, health, wider cross-sectoral partnerships to improve the health and well-being of people as they age in Ireland. Most people are aware that in Ireland we have placed a significant emphasis on improving the lives of people as they age and on positive ageing. And a lot of this cross-sectoral work has been led by Age Friendly Ireland, a national shared service located within local authorities, connecting in with the environment, with transport, with education, with community policing, with health, to deliver a set of evidence-based initiatives at national, regional and local level. And most importantly, the work of Age Friendly Ireland is informed by community-led grassroots action at local level through age-friendly alliances and age-friendly councils, and it's a pleasure to be associated with this work. I have supported the work of Age Friendly Ireland almost since the beginning, and within health we have together implemented a whole range of initiatives. And really the work of positive ageing and the way that it is being approached in Ireland goes to the core of the work that is happening internationally to address wider social determinants of health. And in Ireland, of course, we have the Healthy Ireland framework to improve population health, to reduce health inequalities, to enable every sector of society to play its part. And for me, the pleasure of this work and in seeing all of the actions that are in place and being mobilised across the country really goes to the core of that wider determinants of health perspective and trying to bring a whole of society, whole of government approach to this. And the alignment from a health service perspective with Healthy Ireland is really wonderful. One of the things for me maybe to share with you today where this work has really come to the fore has been in the context of the pandemic. And because of the well-established partnerships between local authorities and health and housing and the creative sector, there has been a huge amount of work undertaken to address the impacts of the pandemic for people right across the population, but in particular for older people. And there have been specific initiatives that you'll hear about today related to physical activity, diet, nutrition, social isolation, well-being. And I think that really seeing all of that work as it's happening on the ground is a testament to the hard work of the Age Friendly Ireland programme and all of the local authorities who have been delivering in this area. One of the particular things I wanted to talk about today and just mention to you is an initiative that is again being supported by Age Friendly Ireland, that is being led by Health, to try to put in place increased supports for those who've been bereaved over the period of the pandemic, or who may have been bereaved in the past and for whom the pandemic has made things difficult. And we know that normal grieving processes have been significantly interrupted by the pandemic, where people would socialise and would engage in a whole range of processes associated with grieving and marking the lives and the passing of loved ones. And we now have an information campaign on social media bringing to the attention to the public that this is a natural process, that there's not 5 stages of grief, that it ebbs and flows. And I'm delighted to say that Age Friendly Ireland will be distributing this information, plus information on the support line and the various different services and supports that are in place for people through the Age Friendly Alliances and through, at a local level, the Older Persons Councils. And this is a perfect example of where we can support one another, we can improve people's well-being, we can support social cohesion and social support at local level through these types of initiatives. And that's one that I just wanted to end with today. Very best of luck with the rest of the seminar. There are some fantastic speakers and some wonderful presentations coming up, and it's been my pleasure to be here with you today.
Thank you, Stephanie. That was a wonderful contribution, and I think it was really poignant. Stephanie mentioning the grief supports in the context of where we've been for the last 20 months, and I'm delighted to see that partnership, a real example with the Irish Hospice Foundation of collaborative work on the ground. And as Stephanie said, we will continue to support all of those partnerships and collaboration through the framework of the shared services. So thank you to Stephanie for those words this morning. Another, I suppose, aspect that has emerged not only in the pandemic but is on the rapid increase globally is the area of Alzheimer's and dementia. And I know in Ireland we have some critical support services provided by our next speaker. I'm delighted to welcome Pat Mclachlan, Chief Executive Officer of the Alzheimer's Society. Pat has a very wide spanning career across the Health Service Executive and a number of state boards. And has, I suppose, one of the best capacities to deliver these services across the country on the ground. And we have heard a huge amount of feedback from our older people's councils and the wider older citizens across Ireland about the immense support that these services bring to their doorstep. So I'd like to welcome our next speaker and panellist, Pat Mclachlan.
Hello everybody. I'm very happy to share with you some information in relation to the Alzheimer Society and how we dealt with COVID. The Society was formed in 1982 by carers in Dublin, and a branch network was established across Ireland. The Alzheimer Society has services in all counties in Ireland, and we have a budget of approximately 20 million. And branches develop services through grants through the health boards and the Health Service Executive. So, just to give you some data in relation to dementia in Ireland, there are estimated to be 64,000 people currently living with dementia in Ireland. And it's also considered that for every one person diagnosed with dementia, 3 other close family members are directly affected. It's also considered that there are 63% of people with dementia currently living in the community, and the balance are living in residential care. So every year there are 11,000 people who are diagnosed with dementia. And it's not often considered an issue, but there are 4,000 people with dementia who are aged under 65 years of age. And those people face particular challenges because many of the services were really developed on the basis of older persons. And they may deal with a quite different range of issues. They may be young with families, with teenage children in school, they may be working, etc. So a whole range of different issues for people who are diagnosed with dementia who are under 65. It's also estimated that there are 500,000 people in Ireland whose families have been impacted by dementia. And when you consider that our total population is approximately 5 million, it gives you an indication of the extent of how it's impacting on families in Ireland. What is dementia? Well, it's an umbrella term used to describe a group of conditions that cause damage to the brain cells. The damage affects how we think, remember, communicate, and carry out everyday tasks. It's a progressive and regrettably an irreversible condition that can affect mood and personality. And dementia is not a normal part of ageing. The symptoms of dementia are outlined there: problems with language, difficulty finding the right word, difficulty managing money, memory loss, particularly for recent events, loss of interest in hobbies, pastimes and going places, changes in mood and behaviour, and becoming confused in familiar surroundings or situations. So there are a number of different types of dementia, but the main ones are outlined here. It's estimated that about 50 to 60% have Alzheimer's disease, that vascular dementia accounts for 15 to 20%, and you have other main areas of dementia such as Lewy bodies dementia and frontotemporal dementia. In relation to the Alzheimer's Society of Ireland, well, we are the leading dementia-specific service provider in Ireland, with services in every county in the Republic of Ireland. And we provide almost 900,000 hours of community-based dementia-specific care. 68% of dementia services in Ireland are provided by the Alzheimer's Society of Ireland. These are dementia-specific community-based services. Our services include daycare centres, home care programmes, daycare at home programmes, family care training, dementia advisors, Alzheimer cafes, support groups and social clubs, and our national helpline, which is open 6 days a week and can be contacted at 1800 341 341. Our national information and advice services covers our national helpline, dementia advisors, and I'm glad to say we have dementia advisors now right across the country with government approval to us to increase from 8 to 28 dementia advisors. We have a mobile information service and we have information resources. So our goal is to be Ireland's first point of contact for people with dementia and their families. And we provide information and advice that we believe is trusted, accurate, accessible, timely and relevant. The breakdown of services provided by the Society as a percentage of national provision are as follows, and this was validated between ourselves and the Health Service Executive. We provide 78% of care support groups, 78% of all dementia family care programmes, 78% of social clubs, 38% of Alzheimer cafes, and I'm glad to say, as I outlined earlier, that we now have 28 dementia advisors thanks to the support of government. And we have 3 of the 7 cognitive stimulation groups in Sligo, Galway and Tipperary. Overall, we provide 82% of all daycare services, and when you put all of that together, we provide 68% of all dementia-specific community services. Inevitably, because of many of our services were face-to-face service, COVID had a massive implication for us. We had to close our daycare centres, we had to stop our clubs, our cafes and our family care training, and we had to move them all to a virtual platform. And this was done very, very quickly. It also impacted on our fundraising, but the pressure for carers and the pressure for people living with dementia continued right through COVID and are continuing. We researched this issue over the past 20 months and we have established that carers are witnessing an alarming deterioration in the health of well-being of people with dementia. They are coping with grief, loss and powerlessness. They see no end in sight. 86% are concerned about a decline in their loved one. 58% of persons living with dementia report feeling lonely, isolated, trapped and confined. So some of the services which we changed: all family care training courses moved online, scaled up to meet demand, and demand has continued and increased, and we are determined to meet that demand for virtual care training until we can resume face-to-face services. We launched a new online support group for family carers, and this is a dedicated online space for family carers to find necessary information, and it's also a chance to build connections with other carers, again all online. We established virtual Alzheimer cafes, and we launched the first one in June 2020, and they have worked extremely well, and we have them established now right throughout the country. We did get good feedback from people living with dementia and carers, and I've outlined some of those on the screen. In relation to the materials that we developed and the activity packs, we got views that there was a good variety of material, ideas to plan and do daily, loves the crosswords, loves the colouring, family fun, words of songs, poems and puzzles. And I suppose more importantly, the comment that people feel supported and that not everybody understands what caring for somebody with dementia in the home feels like. So our services have been very valued. We are re-establishing our services on a face-to-face basis. Of the 47 daycare centres that we operated, we soon will have over 30 of them re-established and functioning with all of the public health restrictions. We have continued with many other services on a virtual basis, and we hope to resume most of our services on a face-to-face basis when we're allowed by public health. So the services now for people who are living with dementia: Dementia Advisor Service. We're still continuing with our social engagement and therapeutic activity phone calls. Virtual sweet memory choirs in collaboration with the Health Service Executive, which have been very popular. The virtual cafes, which I mentioned. The Daycare at Home service, which was piloted with the Health Service Executive in the northeast of the country, and the government have now given us money to establish this service right across the country. Therapeutic activity packs. Our national helpline continued, and we also provided dementia nurses available on a planned basis. And we also have our virtual social clubs. So these are all the services that we established during COVID, and we do intend to maintain a virtual platform even when the pandemic is over. So what's important to remember, we believe, is that you see the person first. Dementia is not necessarily a defining aspect of life, and life does not stop when dementia starts. So it's important that we convey that in the language we use. We couldn't have achieved what we did without the support of the National Dementia Office, the Health Service Executive and the government, who continued to fund us during COVID. Thank you all very much.
Thanks, Pat. That was a great overview of the dementia services. I'm struck by two things: the scale up of the dementia advisors that have rolled out, and I'm really, really delighted to see that, because we know from our older people's councils the actual direct support that gives. But the array of virtual services that are now in place is fantastic. We've heard so many times that, adapting to technology has been difficult, not just for older people, for all people, but particularly for people with dementia. So those essential supports are able to be brought in the pandemic. So commend you on that, and I know we're delighted, and we'll have a great panel discussion where we'll tease out some more of those ideas, because there's some great learning for our international guests. So in that regard, and given the fact that we are in partnering with the WHO on this, we're delighted now to welcome in our next speaker, Asma from the Sharjah office. We're delighted that the Middle East have, taken steps to become age-friendly and have done Trojan work, and we were very privileged to be invited out, and our representative in international relations, Anne Rizzo, actually travelled to Sharjah to share some of our learnings, but equally to learn from them in terms of the practices they've put into place. Asma is the age-friendly programme manager for the Sharjah region in the UAE, and has a very varied background in terms of being a lecturer, managing projects, and also managed the first Healthy Cities project in the Middle East, which was quite an achievement. So we welcome Asma.
My name is Asma Al-Qudari. I am a Sharjah Age-Friendly Program Manager. Today I will talk about the Sharjah initiatives in regard to community and community support and health services domain. Actually, just before we start, I can highlight that Sharjah was and is still the first Arabic city to join the global network for age-friendly cities, which was done in 2016. Sharjah after that developed a strategic plan which is framed from 2017 till 2020. And that strategic plan actually contained a lot of initiatives and practices that support elderly in Emirates of Sharjah. I will try in this meeting or this gathering to highlight the most important initiative in Emirates of Sharjah, which is part of United Arab Emirates. Okay, one of this initiative is mobile clinic services. This services is provided for all Sharjah citizens by facilitating services to the elderly. So for them, no need to go to the healthcare facility. The mobile clinic will come to the elderly houses and will provide the needed services. Most of the services is diagnostic and part of the rehabilitation for the elderly. This is one of the mobile clinic services. The next one is free transportation. Sharjah also started to provide a free transportation for the bedridden in Sharjah. So any person or any bedridden elderly in Sharjah, they can actually get this benefit by applying special application form or by calling specific numbers, and transportation, it will be free transportation to transport this elderly to any place they need it in Sharjah or outside the city. Actually, this initiative was developed as part of the cooperation between Social Services Department in Sharjah and Sharjah Police. So two organizations actually collaborated in order to maintain this unique services to make the life easy for the elderly and for their family. The third also initiative in the same term is the rehabilitation program. Actually in Sharjah, all the elderly, they are actually welcome to receive a rehabilitation services through a social services department. So they can actually try to develop the skills and the knowledge of the healthcare provider or to the home assistant of the elderly. So there is a group or there is a team who will visit the elderly house and they will try to train the person who is providing the care to the elderly at home. And they will certify them in terms of like a small certificate so they can be able to take care of this elderly. And most of the time it's about the first aid and about this wound care, all of these services. Also one of the services that is provided in Sharjah, volunteering services. In Sharjah we are providing a variety of volunteering services. Actually both, it's for the elderly, they can participate and they can be part of the volunteering opportunities, or sometimes we'll make also the young volunteers to support and to accompany the elderly and provide all the support that the elderly will need. So this volunteer services for both elderly, they can initiate this and they can be part, an active part in this volunteering services, or the other category of the community, they can help and support the elderly. Also, we have one service that we are providing it to the elderly in Sharjah, which is the home nursing services. It's called Rahma. This is 24-hour services will be provided to the elderly who are on need. There is special application. If the elderly meet the certain criteria, then he will be or she will be eligible to receive home nursing care services through professional and official nurses at home level. So this is also one of the services that Sharjah is providing for the elderly. Also, we have another things in terms of social support to the elderly, that in Sharjah now they are working in issuing a local system for managing the funds of incomplete or incompetent aged people. So there is a law, and there will be like a policy, public policy that support the elderly who are not able to manage their funds through certain protocols and certain guidelines that it is supported by law. So we started to work on it, and we are expecting maybe mid next year it will be ready to be published. Actually, it is completed, just we are waiting the higher authority to approve it. So the elderly who cannot manage their funds, there will be like a law or regulation to manage this part. Also in Sharjah, one of our initiatives for the 2017-2021, we actually develop also partnership with the private sector. We believe in Sharjah that the private sector, there are key elements in providing high quality care for the elderly. So a lot of actually agreement and MOUs was signed between Sharjah and the private sector. The aim of this actually partnership is to facilitate for the elderly so they can receive certain services. Example, discount of a lot of lab result, radiology services, even the medical and medical equipment and medical instrument. So agreement was done with the private, few actually private sector like hospitals, medical clinics, pharmacists, pharmacies, also medical companies. So we get an agreement with them and the MOU so they can provide actually a discount for the elderly. This is also part of support that health support, health service support that we are providing it to the elderly in Sharjah. Actually, we developed a new also strategic plan from 2021 till 2013. And in this plan, not yet started, we are starting at this actually late of this year. We are planning actually to provide elective courses or diploma in geriatric. So anyone who is like a healthcare provider or social worker, they can actually have a special diploma and special training how to deal with the elderly. So in terms of this geriatric specialization, and we did this actually initiative with the cooperation of one of the university, accredited university in Sharjah. Also, we are planning in our coming strategic plan to do something called Living Lab. In this Living Lab, it will be like simulation, and it will be like smart rooms or houses where the elderly can benefit and can utilize all the aspect of the house through using the technology and make like the furnitures, the toilets, all the house facility reasonable and approachable and easy to be used by the elderly. And this actually, it will be really extra credit that the elderly, they can have it. And it will start it as a simulation. So the elderly, they can try how they can get benefit of this technology. Also, we are doing, we are planning this year also, and for the coming 3 years, that to provide special programs for the elderly evacuation. In Sharjah, we have disaster and evacuation plans, but we put as an initiative that the elderly, we should consider them in all of our evacuation and disaster plan. It was mentioned in the previous one, but this strategic plan, we made a special actually focus on that. So we should not ignore or neglect the elderly in terms of when disaster is happening, or if we need an evacuation or any term of emergencies. So we developed this and we are continuing to finalize it. Also, we have something called a guide to protect the rights of the elderly, and we are planning in this actually guide. We started already to do this guide. Will provide all kind of support to the elderly in terms of laws, in terms of regulation, in terms of services. So it will be a comprehensive guide how to protect the elderly with the support of the decrees, laws, and guidelines. Also, we have something called health awareness. We are trying also in this year with the cooperation of other agencies and NGOs that will provide health awareness to the elderly. And we'll try to utilize the international days like diabetic days, all heart days, in order to support and provide all the free diagnostic procedure to the elderly through creating an awareness and do a health promotion. And we'll do this with the University of Sharjah, Faculty of Medicine and Health Science. Also, we have an NGO which is called, it's under the Family Supreme Council. We will cooperate with them in order to do like a health awareness and health promotion for the elderly. Part of this initiative will make the elderly also to participate with and to share their experience with a chronic illness. So if any elderly who are diagnosed recently like a diabetic or hypertensive, the other elderly, they can share their experience, how they are dealing with their chronic illness and other illness which is related to the aging. So it is one of our initiatives. Also, as I mentioned before, we have a mobile clinic, and we thought we will promote and develop this kind of health services by adding extra services to the mobile clinic. So we'll expand in terms of the diagnostic procedure that we are using, and we'll try to go for the bone screening, and other kind of screening will be part of the mobile clinic. So this is part of our plan in our new strategic plan. Something also I would like to highlight and to share the way that Sharjah dealt during the period of COVID-19 pandemic. Sharjah actually reacted really significantly to the pandemic by initiating new services which was not actually present in Sharjah. But because we want to support our elderly, they developed actually a few services. One of this to conduct a regular visit to the elderly in their houses. Usually this regular visit not only for the healthcare sector, but also by the social workers. So they can visit the elderly and to break their isolation and try to see their needs and to provide all kind of social and psychological support to the elderly. Also in Sharjah, we initiate something called e-clinic during the pandemic. Until now, actually, for stable cases, still this services is available. So any elderly who have like a regular checkup, medical checkup, no need for them to go to the hospital or to the clinic or to the PHC. There is something called e-clinic. E-clinic where the doctors virtually will talk to the patient and he will talk to him and he will try to get information about his health status, and based on that they will actually follow his case. Of course, if the elderly need more care, they have to come to the hospital, but stable and regular checkup will be done through the e-clinic, which is initiated actually during pandemic of COVID-19. And still actually we have it for stable cases this service is actually provided widely in Sharjah to protect the elderly from getting infection. Also, we have some another services that we are providing it in Sharjah, which is the home medication delivery for any elderly. No need for them to come to the facility, even their relative, to collect the medicine. Actually, in terms of social and health support, we are actually providing the regular medication to the elderly houses. So by phone call, the elderly or his relative, they can get all the medication that the elderly need usually for his chronic case and for his regular cases, by delivering actually the medication till their houses through our healthcare providers, which he or she will explain how to use the medication. So medication will be delivered to the elderly houses. Also, during the COVID, and still we are continuing it, our old people home, which contain actually an elderly, they did a lot of measures to protect the elderly by providing all the infection control guidelines and the standards and the general precaution to protect the elderly. So the staff was trained how to deal with all infection control aspect. The visiting actually our regulated, and the visitors actually to the elderly regulated by doing a virtual visit, and also the place itself considering the social distance and all of this infection control precaution also maintained and actually strictly followed to protect the elderly from getting the infection. And successfully during the COVID, no one in Sharjah got infected to corona in our old people home, because of strict actually precaution and special care that provided to the elderly, restricting all chance of getting the infection. This is the final, and this is just a brief for some of the services that Sharjah providing it to the elderly in terms of social and health services and support. And I will be ready for any answer or clarification. I try to make it very simple and to the point, but still if any clarification, still will be able to highlight the inquiries and questions.
Thank you, Asma. That was a fantastic presentation. I'm really looking forward to the panel discussion, particularly the really innovative practices like the home care hospital-based model and then the mobile clinics. I also see a lot of similarities between the COVID response, so really interesting to look at that and to hear from you. So we look forward to you coming in live for the panel discussion. Thank you, Asma. Before we go any further, can I just remind people that they can start, I'm already seeing it coming in now, the questions coming in by Slido. So on our live feed, you can click that link. And also if you're tweeting, if you could tag us at AgeFriendlyIRL, and you're obviously free to tag any of the panel speakers and speakers that have come in, and use the hashtag policy to practice. So we look forward to seeing your tweets and your interaction with us as we progress through the webinar. So next on the agenda, I'm really delighted to welcome two colleagues, Dr. Emer Coveney. Emer manages the national team-based framework of 31 age-friendly programmes across the country. And then we also have a regional team of 6 regional programme managers. So the next presentation is really focusing on the step-by-step process that we engage in when we're trying to look at good practice and scaling it up nationally. And Alice would have led in the development of the age-friendly primary care guidelines and would have also been involved in the age-friendly hospital in Kilkenny. And I suppose we're often asked by our international partners about the collaborative process, this 4-stage process we go through, and central to that is the voice of older people as co-designers of everything that we do. And services are designed with older people and by older people as opposed to for older people. So looking forward now to hearing from Emer and Alice in the context of the 4-stage process and scaling up good practice.
Thank you, Catherine. Hello everyone, my name is Emer Coveney and I'm the National Programme Manager with the Age Friendly Ireland Shared Service, which is hosted by Meath County Council. I'm going to speak to you today about some of the health and wellbeing initiatives delivered locally and nationally here in Ireland by the Age Friendly Programme to support older adults. Community supports and health services is one of the 8 domains of the World Health Organization's global programme. So as an affiliate of the WHO Global Age Friendly Programme, Age Friendly Ireland operates in line with their international resources and guidelines. In relation to health and wellbeing, the WHO checklist for age-friendly cities points up issues such as the accessibility of health services, the range of services, including home care and community supports, and emergency planning. These resources provide the guiding framework to plan for making health services and community supports age-friendly. In Ireland, there has been very strong collaboration between the Department of Health, the Health Service Executive, and the local government-hosted age-friendly shared service. Both the Department and the Health Service are represented on the National Advisory Group for the shared service. The Integrated Care Programme for older people provides a formal structure for working between acute, primary care, local government and other stakeholders. There are many examples of other collaborative work in the field of health and wellbeing being carried out in the interests of older people and in preparation for an ageing population. Firstly, today, I would like to speak about Age Friendly Ireland's guidelines for age-friendly hospitals. As people age, they can spend more time attending both inpatient and outpatient hospital services. This means that older people's health and thus their quality of life can depend on how age-friendly our hospital environments are in supporting older people. St Luke's Hospital in Kilkenny was the first in Ireland to go through the process of becoming recognised as an age-friendly hospital. A programme of work over several years resulted in many changes in the hospital, both in terms of the built environment and service delivery. Changes included additional seating, the introduction of the Geriatric Emergency Medical Assessment Service, a physical activity campaign called End PJ Paralysis, staff training and awareness about older people's specific needs, transport improvements, age-friendly car parking at the hospital, and signage and wayfinding. Central to this work was consultation and the involvement of the citizen through Kilkenny Older People's Council. The process was managed by the Kilkenny Age Friendly Alliance, working closely with the Health Service Executive and hospital management and staff. These guidelines are now available to be utilised by other hospitals in Ireland undergoing an age-friendly process, and indeed this has started in several hospitals. In relation to the COVID response, local age-friendly programmes in all 31 local authority areas were extremely active in supporting older adults' health and well-being during COVID-19. Hundreds of new initiatives were developed across the country from the start of the pandemic in March 2020 to support older people who are cocooning. These health and wellbeing initiatives ranged from writing and poetry, music, portrait painting, online physical activities, online cookery, and healthy food tips on radio. In many counties and cities, care boxes or wellbeing packs were distributed to older people by age-friendly programmes. This example is from the Donegal age-friendly programme, which, as you can see, was filled with information, food items, flower bulbs and seeds, Christmas cards and treats. The importance of having a database of older people or vulnerable adults in the community for such emergency situations cannot be underestimated, and having local knowledge of how to reach older people in need. Older People's Councils established under local age-friendly programmes are very important in this regard. And I'm now going to hand you over to my colleague, Alice Corbett, who will speak about developing age-friendly primary care centres and other health and wellbeing initiatives. Thank you.
Thanks, Emer. Hi, I'm Alice Corbett, the South East Regional Manager with Age Friendly Ireland. I'm going to take you through the process we used in order to deliver on one of the actions in the Housing Options for the Ageing Population Statement of Policy. We developed the primary care centre guidelines as part of the support mechanism to enable the ageing population to age in place. There's a national commitment to the health reform programme called Sláinte Care to increase community and home-based care through planning for an increased primary care infrastructure. These guidelines were developed in partnership with the Health Service Executive and with Wicklow and Kildare age-friendly county programmes. A guidance document was developed based on consultation with older people and older key stakeholders for the 2 new developments in Athy, County Kildare and Baltinglass in County Wicklow, using the World Health Organisation's framework on healthy age-friendly cities and communities. Age-friendly staff worked with the health service executive and developers to frame the guidance material, drawing on Irish universal design standards from the Centre for Excellence in Universal Design, based in the National Disability Authority, and the World Health Organisation's age-friendly primary care healthcare toolkit. A checklist has been developed to inform all future developments. Some of the key considerations identified during consultation were based on signage and wayfinding, particularly for people with dementia, disabilities and visual impairment. Colour coding, contrast, light reflectance and tactile finishing were some of the important areas to make the centres truly age-friendly. A specific workshop was held with older people, people with disabilities and carers to identify adequate signage to enable equality of access and participation. Location, universal design, transportation links and age-friendly parking were also key considerations. Follow-up walkability audits were held in both centres, where older people used the checklist to see if the standards had been delivered. Some examples of comments from the older people included: I found the primary care centre did meet the required needs of older persons. The parking was excellent with age-friendly signs. The centre is well located, it's fully accessible, bright and inviting. A wonderful accessible addition to the county, had a lovely welcoming feel. Local age-friendly programmes are involved in delivering many health and wellbeing supports for older people in their communities through the delivery of local age-friendly strategies. There are good links in place with the voluntary sector, local transport providers and community groups, as well as cross-departmentally in local government, working with the libraries, art offices, heritage, climate action and sports partnerships. Some key local age-friendly health and wellbeing initiatives include movement minutes with Age and Opportunity, positive ageing events and webinars, local sports partnerships, delivering exercise programmes online, through video, and providing leaflets for older people, winter wellbeing packs and food hampers, intergenerational engagement such as pen pal projects and befriending services, all designed to enable older people to continue to live active and healthy lives and remain part of communities that they have developed and shaped throughout their life course. Thank you.
Thank you, Alice and Emer. I think that was a wonderful overview. And I think what's really important is that we don't just look at buildings in their own isolation, that we look at the surrounds, how to get to them. And I think that's really important, particularly for other countries, that we're looking at that wider context. And we look forward to the panel discussion and maybe teasing that out a little bit further. So next on our agenda is Dr. Noel Mccarfrey. Noel has a varied career, and Noel, we know that you're involved with Kappa Hospital and the Mater, and you've been in DCU. And we also found out as well that you're a medical advisor to Riverdance, and we didn't know that, as well as being a fantastic footballer. So, but what Noel is, and where his passion is he's the Chief Executive Officer of the Exwell Program. And we know now more than ever the importance of physical activity, particularly in preventative health measures. And this medical exercise program is something that has really resonated with older people, and it's very, very impactful, and we're delighted to see the scale up of it, and it's very pertinent in the context of the domain that we're speaking to today. So welcome, Dr. Noel Mccarfrey.
Yeah, that's fine, an agreement. Yeah.
An agreement. You said if there's any kind of referral process at the minute.
Hi, my name is Dr. Noel Mccarfrey. My area is exercise medicine, and I want to tell you a story today about Exwell Medical, which is the perfect expression of what I call exhilarating medicine, because it has impact, and it has impact on people with chronic illness, and it's a wonderful story, and I'd like to share it with you. So I want to tell you about our mission. I want to give you the context of why this is all important. I want to explain the rationale of how and why exercise works in chronic illness. I want to explain what happens for participants when they sign up for Exwell. I want to explain the model and how it's evolved over time. I want to give you some of the evidence of impact, because that's really important. I want to share our vision for scaling, nationally and indeed internationally. And I want to just finish off by talking about some of the challenges. So our mission is to fundamentally transform the lives of people with chronic illness through the delivery of community-based clinical exercise programs. And we want this to be made available to everybody who needs it as quickly as possible and as affordably as possible. The context is this. Chronic illness is the biggest public health challenge facing Ireland and indeed every first world country. It consumes about 75% of our own total annual health spend, which is €20 billion. It is the biggest public health challenge facing us, and it's going to get worse and worse as time passes because of an ageing demographic. And chronic illness, by definition, does not go away. These are things like heart disease, lung disease, diabetes, arthritis, chronic pain, and it affects 40% of our population. It affects 85% of people over the age of 65, all of whom have one chronic illness, and 65% of that age group have 2 chronic illnesses or more. It has profound effects on families, communities, and on society. And that's the bad news. The good news is that a lot of the disability and the unwellness with any long-term illness is in fact caused by deconditioning or becoming unfit. And what happens is, if you are inactive and people with chronic illness become less active than other people, you lose your fitness, and all aspects of fitness disimprove. Strength, aerobic fitness, flexibility. That causes immobility. That causes social isolation and loneliness. That leads to lack of motivation and fear of exercise, and a further reduction in physical activity, and the cycle goes on. The point is, we can fix this. We can fix the physical inactivity through exercise, and we can fix the associated loneliness through the social interaction of group exercise classes. And that has profound beneficial impact on quality of life for people and also for families, because one of the hidden stresses with chronic illness is what happens to carers, and the distress that's involved in caring for somebody who is ill is often hidden from that person because the person caring does not want to make them feel worse, and that's not good for the carer. So there's a ripple effect of chronic illness on families and on communities which is greatly underappreciated. And what happens when you offer group exercise is that there is a rapid and profound improvement in quality of life, a restoration of joy, of hope, of mobility, a building of resilience, and that affects not just the sick person, it also affects relatives, families, and indeed communities.
And walk. Now the experts want us doing 5 30-minute sessions of moderately vigorous aerobic activity every week. We'll give you 2 of those sessions, you'll do the rest at home yourself.
When somebody attends a clinical exercise program like ours, it starts with a referral. So the referral is from a doctor or a community-based physio or an allied health professional. That's followed by what we call an induction process, which can happen online or face-to-face. And the face-to-face induction involves a talk in which we explain the rationale for exercise, we address safety issues, we talk about motivation. And the induction process also involves baseline testing, where we measure the important outcomes, namely strength through low-tech tests like the sit-to-stand test. We measure falls risk by doing the timed up and go test. We look for early cognitive decline by doing the dual task test. We measure aerobic fitness by doing the 6-minute walk test. And we assess self-rated health through the EQ5D questionnaire. It's really, really important to capture that data. If I was to summarize things, the exercise program itself, the impact measurement, and the social interaction are equally important.
Swing, 2, 1, 2, 1, 2, 1, 2, 1, 2. And relax.
Now, when it comes to the class, having done the induction, the participant then takes part either online or face-to-face, and the class itself has three important core elements, which are aerobic exercise, strength work, and balance and core stability. They're all important, and we need to cater for different abilities in the same class. That's easily enough done by offering two different levels of intensity for different exercises, or by using a low weight or a heavy weight, depending on the ability when it comes to strength work. So it is possible to accommodate anybody, and our philosophy is that nobody gets turned away. Everybody can take part, and our job is to find what can they do when they come, not can they come. The delivery model for the Exwell program has evolved since we started about 15 years ago. Back then, the approach was to offer specific programs for different illnesses. So we had a program called Heart Smart for cardiac rehab. We had a program called Breathe Smart for pulmonary illness. We had a Smart Steps program for claudication. What became clear over time is that everybody, in fact, gets the same content. Everybody gets and needs a combination of aerobic exercise, strength work, and balance. So we have moved to offering our exercise program based on functional ability and not based on disease, with some exceptions. The exceptions being cancer, and the reason for that is that there is an enormous emotional support within a coherent cancer group, which is a little bit unique. Another example of a disease-specific program which is worth persevering with is in fact claudication, which is peripheral vascular disease, and it's the one program where we ask people to experience pain, to walk to the point of getting pain and to walk through it. And it's a little different from other programs. And for that reason, there are one or two situations where disease-specific programs are appropriate. But by and large, it's much better to offer everybody a shared program, which has the benefits of exposing people with specific illnesses to people with other illnesses. And that's a healthy thing. The other thing that it's good for is it allows us to scale, because we're not then feeling the need to offer individually unsustainable programs for specific illnesses to everybody with a different illness. Instead, we can all come together and benefit from shared content, shared delivery infrastructure, and that's important. The other aspects of the delivery model have been a function of the pandemic. Pre-pandemic, we were operating with huge groups, classes of 80. Since the pandemic struck, we had to initially stop completely and go to online. We then got back to group classes with small pods. We then got back to slightly larger groups, and eventually we migrated to doing outdoor classes, which was a wonderful transition and a great discovery actually, and a positive effect of the pandemic, because exercising outdoors has a few really important impacts. One, people feel safer, they feel resilient, but also it brings the program into full view of people walking by, walking their dogs, and it just normalizes exercise behavior for people who usually are not exercising, namely those people with chronic illness. And the whole thing about chronic illness is that it is a cohort of people who are very often too well to be in hospital, but not well enough to take part in five-a-side or tennis. So they get nothing. They're not getting hospital care, and they're not getting the opportunity for physical activity. That's where community-based clinical exercise options are really, really important to help with the transition from hospital care into, let's call it, mainstream sport. And there needs to be a fluid movement between the hospital into mainstream sport and physical activity through this safe environment of clinical exercise, and with the opportunity to transition both directions. If somebody's exercising in mainstream sport and gets sick again, they need to be able to flow back through community-based clinical exercise, and if necessary, back into the hospital. Now, a really important aspect of this is impact. And I've explained already why it's important to measure impact. But the gratifying thing is that when we look at our results, they are powerful. And we can show that after a very short program of 6 weeks, in a cohort of people numbering nearly 300, we demonstrated that all of the main outputs improved. That is aerobic fitness, strength, falls risk, and self-rated health. They all improved, and the thing was, they improved rapidly within 6 weeks. They improved beyond what's referred to as the minimal clinically important difference. And that's a very, very important point. And most importantly, the biggest benefit was seen in those who started off the frailest. So that's important. We have an inexpensive, accessible chronic illness management strategy which is impactful quickly and most impactful for those who most need it. To illustrate the impact, can I just take you through this slide about the 6-minute time trial? So what you see on the left is the change that occurred from time 0 to 6 weeks in the entire group. And you see an improvement in the 6-minute time trial. That is an increase in the distance covered. The 3 sets of bars to the right show the same figures with relation to the lowest, the middle and the upper, what's called tertile. So the lowest tertile is those who started off with the worst 6-minute time trial performance at baseline. And you can see that the proportional increase is greatest in that group by comparison with the other 2 tertiles. The message being that the impact is significant, but it's greatest in those who start off the weakest. With regard to scaling, so our mission is to bring the service to everyone who needs it. And it's based on partnerships. So as we go around Ireland, we're identifying local partners in different parts of the country who share our ethos and who are willing to buy into making this available. So that may be GA clubs, it may be county council, community halls. All sorts of partnerships are important in making our scaling mission possible. From a funding point of view, the challenge is how do we make it work? We're a social enterprise, and without funding support from someone, the participant has to pay, which is fine for some, but it's a barrier to others. Recently, we've had great success in forming partnerships with the HSE in our project in City West, which is fully funded by the HSE. That led on to a project in partnership with the Dublin Midlands Hospital Group, which is also fully funded. We have a funded project in the inner city with the North East Inner City project, and now in Fatima, supported by the Smart Dublin Group and also by some corporate partners. And then in other situations, we have what we call partial funding. So we have a partnership with some GPs up in Balbriggan where they're part funding the programme. So there's many ways of doing this, but ideally the beneficiaries would pay, namely the government through the HSE, the participants themselves to put some value on it, but also the health insurers who have a role to play here, because it is without question true that their clients, if they exercise regularly and if they have chronic illness, will become less of a burden to the health insurers. A quick status update. Exwell now has a team of 12. We're operating in 9 centres. We see 1,500 people a week with face-to-face visits. We're involved in several special projects which are interesting, including, for example, a project to bring the Exwell programme into the homes of home care service users. Now that's very interesting because these people are at risk of 3 major transitions, all of which are life-transforming and expensive, namely becoming bedbound, becoming hospitalised, or transitioning into long-term nursing care. And if by leveraging the skills of the delivery staff from the point of view of the home care service, we can bring the exercise programme into their homes, that will be a huge impact. We're also looking at an Exwell Junior programme because chronic illness affects children as well as adults. About 22% of children will have some form of long-term illness between childhood and adolescence, and offering them an exercise opportunity normalises school experience. It assists in forming social networks and sustaining them, and it also has a profound impact on the dynamics within families where there's a chronic illness. The whole cancer story is very interesting, and it's becoming clear that exercise has a huge role to play at all stages in the cancer journey, both from prevention to minimising deconditioning during early chemoradiotherapy, to enhancing recovery around surgery, and to minimising the risk associated with long-term medication that is needed to treat some long-term illnesses.
I'm really enjoying the class. They're great for the mental health as well as the physical health.
The involvement when the COVID is on, especially when we're doing it outside in the open, fantastic.
This course has just changed my life. I'm very grateful for it.
No matter what the obstacle in the class, it can be easily adapted.
I'm coming here about 13, 14 years, and the difference it has made to my life it's immense. I'm able to get up and do my park run every Saturday morning.
Well, apart from the obvious physical benefits of the class, it has huge social benefits as well, in that people have a chat afterwards and engage with each other.
After 15 years, Noel, it's the best thing that ever happened to me coming to these classes. I feel like a young lad.
So in summary, we're involved in a fantastic project. All of our team loved it. It's a privilege to be given the opportunity to assist with a life-transforming intervention. We've worked very hard on delivery models and on collecting impact, and we're making great progress. We're delighted to share that information with anybody who'd like to hear more.
Thank you, Noel. That was fantastic, and some great questions coming in, a lot of food for thought. So looking forward to the panel discussion. So I'm reliably informed that we can bring in Minister Mary Butler now before we go to our panel discussion. So whilst it's at the heel of the event, we welcome now Minister Mary Butler.
Dias Miragwith Galair, I am very pleased to be with you here today for the webinar on community support and health services. This is the second in a series of webinars that will explore Ireland's response to the 8 domains of the World Health Organisation's Age-Friendly Cities and Communities programme. As Minister for Mental Health and Older People, I am delighted to speak about Ireland's continuing progress in providing health and wellbeing supports for our older population and the excellent collaborative work ongoing between Age-Friendly Ireland, hosted in the local government sector and my own department. This work is critical to ensuring that our older population has access to appropriate and affordable community and healthcare services. With a rapidly increasing population of older adults in Ireland, it has never been so important to focus on community supports and health interventions that will allow older people to live long and healthy lives. I am happy to say that Ireland is a leader in introducing many innovative practices in this regard. As the first country in the world to be fully affiliated to the World Health Organisation's Global Age-Friendly Programme, we take our position and our responsibilities in this regard very seriously. Indeed, a vision for an age-friendly Ireland is written into our programme for government, and age-friendly principles are embedded in major policy frameworks such as Sláintecare and the Healthy Ireland Framework. Health and well-being are supported and nurtured through the creation of age-friendly environments, age-friendly services and age-friendly communities. The work of Age-Friendly Ireland also very much complements the health services clinical teams in acute and primary care settings, and indeed both sectors are successfully working collaboratively through the Integrated Care Programme for older people. The Wexford Telehealth initiative is a very recent example of this collaboration. There is no doubt that Ireland is committed to realising the ambitions of the UN Decade for Healthy Ageing. We will hear today about Age-Friendly Ireland's work in creating age-friendly environments through initiatives such as age-friendly hospitals, age-friendly primary care centres. We will learn about the Exwell medical programme, one example of an Irish-developed medically based exercise programme for the management of chronic conditions. We will also hear about the wonderful work of the Alzheimer Society of Ireland and the wide range of supports they provide to people with dementia and their families and carers. I was delighted to launch last month the expanded National Dementia Advisor Service after securing funding in last year's budget for 11 additional dementia advisors. This brings the total number of advisors to 28 nationally, improving access to this vital service for thousands of people in communities across the country. Building on the investment made this year in community-based dementia services, I have secured an additional €7.3 million in budget 2022 for dementia. This will allow for further developments which will promote sustainability, timely access to care, and enhanced pathways of care for all people living with dementia and their families. In addition, the proportion of new home support hours that will be ring-fenced for people with dementia will more than double from 5% this year to 11% in 2022. Other key developments in community-based health services for older people include the ongoing work to develop a statutory scheme for home support. Funding has been allocated to recruit 130 posts to support the national rollout of the Interoi as the standard assessment tool for care. A national home support office is in the process of being established, and a home support pilot commenced last month in one site, with other pilot sites to be fully operational by January 22. Furthermore, between 2020 and 2021, there has been a significant increase of approximately 2.5 million in the number of home support hours delivered nationwide through enhanced investment. The reopening of daycare centres for older people has been an absolute priority for me following their closure last year due to COVID-19. Over 200 centres have reopened to date, and more are expected to reopen over the coming months. Such centres are fundamental to promoting the health and well-being of our older population. I would also like to acknowledge the work that is progressing on the development of community specialist teams for older people in line with the Enhanced Community Care Programme and community healthcare networks. 30 older person teams are planned, with 15 of those already in place and another 3 at an advanced stage. The aim of these teams is to deliver end-to-end care, keeping people out of hospital where possible, enabling a home-first approach and ensuring people are discharged from hospital without delay. Health and housing are now seen as inextricably linked, and I'm very pleased with the excellent progress made under the Housing Options for Our Ageing Population policy statement. The final report of the group, tasked with overseeing implementation of the statement, is to be published in early 2022 and will outline the significant progress that has been made to date and the plans for taking the strategy goals of the policy statement onwards. I very much welcome today's webinar and the opportunity it affords us to reflect on the fact that even in these difficult times, there are many positive and innovative initiatives ongoing that promote and support healthy ageing and the development of community health supports in Ireland. We have a lot to share with our international colleagues in terms of older people's health and well-being, and no doubt we also have much to learn. The World Health Organization and its global affiliate network is an invaluable support in transforming societies to be prepared for population ageing. I would like to thank them for the support for the programme in Ireland and for their backing for this webinar series. I would also especially like to thank Age Friendly Ireland for organising this event, to commend them for their tireless advocacy on behalf of our older population, and to thank them and the other speakers today and all those in attendance for taking the time to be here. Gorv Míle Maithaguz Guléir.
Thank you, Minister Butler. As always, Minister Butler has done Trojan work since she came into office and took up the mantle. And in the face of the pandemic, I've never seen so much progress. So we're really, really delighted with all of the work that is happening on behalf of older people by Minister Butler. And we send our thanks on behalf of the wider society. So thank you, Minister. So the questions have been coming in hot and fast. So we're going to now go into the questions and answers for about 20 minutes before we close up. And Pat, there's a couple of ones coming in about just about what Minister was speaking about there, the statutory home care support scheme and the impact, or that policy impact, and the impact on people with dementia specifically. So maybe you'll talk us through that.
It's really an important scheme for us because it will have a statutory framework, and as the Minister has outlined, really key part of that will be the needs assessment, and people with dementia have particular needs that we hope that the scheme will deal with. It will also have a regulatory framework so that the providers will be all regulated and standards will improve, and we would also hope that people will make a career choice to go into home care. And if we have a strong home care scheme, it will mean hopefully that people can live longer in the community without having to go to residential care.
I think that's really important, apart from the obvious things like the cost effectiveness and people wanting to remain in their own homes and the quality. Even the impact on people training in that sector, it's going to be great to have, you know, more enterprise and job opportunities for people, because we've seen a sort of labour shortage in nearly every workforce, Pat, with demographic change. So it's an aspect that we really have to look at to plan for the future. And Pat, just while I have you, another question that's popped in relation to yourself about, I mean, there was a huge array of work that you're doing. 68% of your work is being delivered through your organisation. But just a question around how does an NGO like the Alzheimer Society work at local level with the health services and other public services? So maybe just tease that out a little bit.
It's a good question. At the level of the organisation, we have a service level agreement with the Health Service Executive nationally and with its regional organisations. So that sets the framework for the services that we provide and the cost of that. But more importantly, we work with the local health sector personnel on the ground. So the memory clinics, the public health nurses, the GPs, all of those work very closely with our staff on the ground so that they identify the need and they identify the people who will benefit most from that. And the Dementia Advisor Service, which the Minister has outlined, has for the first time meant that we have now a Dementia Advisor Service right across the country, available on the basis of need, not on the basis of history. And that's the way we would like to see the service running. So contracts with the HSE nationally, we provide the service, and we also do the lobbying on behalf of people with dementia and the carers. And I'm glad to say the Minister has outlined the additional monies which have been provided by government on foot of that lobbying, which has been done over a number of years.
Thank you, Pat. And Emer, I'm going to go to the other side. Just a question around the process, which you went into a good bit of detail on, but just the time frame for the process, you know, for doing age-friendly hospital or thereafter.
Sure. I suppose just to explain the process, it's a four-stage process, as you referred to earlier on, for any of the programmes that we're operating. So say, for example, with the age-friendly hospital, they would have commenced work in about 2016 and maybe completed the process then in 2019. So that was a very large facility, very large institution, so that took a couple of years. But the four-stage process is essentially you set up, so you organise like a steering committee, you involve senior management level, older people's council representatives and staff from, you know, the building that you're working with. You consult with the older people and the service users. So you can consult through focus groups, through a walkability audit, bring them through the built environment of the hospital. You can have surveys, you know, to hear the voice of the citizen and bring that into the whole process. You develop the plan based on the findings, so you analyse the findings that have come back from the consultation process and develop a plan, and then you act as the fourth stage, and you implement the plan, and critical to that then is the monitoring of it as well. So as I said, it can be a couple of years or, you know, for a very large facility, but we apply that same process to anything, whether we're working with an age-friendly business or an age-friendly library or a train station. It's the same four-stage process. So a smaller facility like maybe a public library, if it's already a new building that's fairly accessible, the process can be ran over a shorter time period. So it could be 6 or 9 months. They might be more looking at things like their programming for older people and maybe only a few kind of capital works like age-friendly car parking and that. So the process can take, you know, as long as it needs to take in terms of the context of the size of the organisation.
Thanks, Emer. Yeah, and I think just before I go over to Alison and Noel, another question relating to that, Alice, maybe gear it towards yourself, because what they're talking about, the ongoing engagement, once the process is done, then how do we make sure that older people still have a say in how's it been implemented? So we've not just claimed to get this accolade and we don't know that it's working. So maybe talk me through that a little bit.
Sure, I suppose the important part is that the older people are engaged from the very outset. I know when we were designing the primary care centre guidelines, we made sure the older people were involved with the developer at the time in selecting the areas that are important to them within the facility itself. And then at a later stage, it's the walkability audit afterwards, because our main concern here is that it is age-friendly, and that is the universal design approach, which encourages everybody to be involved at a very early stage, not just older people, but people that would need that facility right through the life course. So you're talking about people with disabilities, people with visual impairment, and even young mothers with buggies, Catherine. Yes. It's very important that they have their accessibility as well. So, so the involvement of the older person is at the heart of what Age Friendly Ireland does, and that's what keeps me passionate about the programme.
Absolutely.
It's so important to hear that voice, because we can always assume that we know what's best, but It's only when you listen to the voice and give them the real opportunity. It's a rich voice and it's a very important voice.
Thank you, Alice. And just on that, Asma, maybe we'll bring you in the whole way from Sharjah. You're very, very welcome to all our panelists today.
Voice clear. The voice. Yeah, now it's clear.
Can you hear me okay, Asma?
Yes, now yes.
You can, that's okay. Maybe my mic has dropped at the back here.
Yeah, the mic.
Apologies for that. Asma, just wanted to ask you, do you see similarities between the Irish programme and Sharjah, or any specific initiatives that you see similarities in?
First of all, I would like to thank you really for giving a chance to Sharjah to be part of this respected and really unique meeting and webinar. It's very beneficial for us in Sharjah because we used all the support from Ireland age-friendly program. Still, we can remember how much you were supporting us in initiating our program. So special really thanks and appreciation for your support. In regard to your question, yes, actually there is a lot of similarities because I think it's most of this initiative we have it in Sharjah. Yeah, most of this initiative we have it in Sharjah, and really something is I like it also that the PHC, the age-friendly PHC and hospital. We have also, maybe I did not mention, we have also similar initiative, like to make the organization in Sharjah as age-friendly organization. We developed some criteria regarding the infrastructure, the services, and we actually make like a competition. Whoever want to submit or apply for this competition in order to get actually a plaque that they are an age-friendly organization. So yes, most of them they are similar. Maybe something related to Sharjah that we have to work more on the physical mobility. Maybe here the culture in Sharjah, more sedentary lifestyle. And I think this is because maybe the hot weather, we are in summer, we have a lot of, the weather is not encouraging. Plus the culture itself, it's not supporting the mobility. So I think for us as I learned today from your actually experience and your initiatives that really we should work more on this aspect, like the mobility. It's very, very important. So I like the way that you have really an excellent program for the elderly mobility and exercise, which should be really encouraged and supported by us as Sharjah Egypt Rugby Group. But most of the initiative, yes. And still we are learning and we'll learn more.
Absolutely, Asma. I think that's a good point because we have a suite of resources available through Age Friendly Ireland, guides, toolkits, checklists, recommendations. Every time we do a first, like whether it's a hospital or a library, or the process is documented so that it can be shared with other countries. And the other thing we have in Ireland as well that no other country has is we have a dedicated Centre of Excellence in Universal Design at the National Disability Authority. So they have produced all the universal design guidelines, and those principles can be shared around the world, and it's really, really important that other countries can learn from them. So thank you for that, Asma. Noel, lots of questions coming in about the Exwell Program, and I think it's quite exciting because I suppose when I first seen the exercise program for Exwell, what struck me was there was a bit of medical governance, or the doctor was there to have a look at you, and there was a great trust, and there was a slight difference to that, to go into the gym and paying your subscription, that you felt that you had that support, particularly if you had the chronic disease. So a lot of interest in it, and I'll run through a few of them. But what people want to know is your structure. You mentioned the social enterprise, and there was various funding models, but if we wanted to roll this out across the whole country, what's there and what does it take? Do you know what I mean, to roll it out?
Well, it's really interesting, and thanks, Catherine, for asking that, because it really is the key point. So during the pandemic, the The service we offer was given permission by the HSE to continue, which was a good validation in the first place. It's a bit like Pat's work with the Alzheimer Society. It is a trusted partner of the HSE. A lot depends in our end on goodwill and collaboration and confidence from the hospital sector, and we have built that up over the years, and that's really, really important. And a great example of that was when we started in Tala about 3 years ago in collaboration with Tala University Hospital. It just exploded because it was driven from within the hospital. But then at a local level, if we're trying to move this around the country, then there are really, I suppose, two models. And one is that we, Exwell, in our team would come somewhere and run the service in a facility that is somehow provided to us just as a rental or by the local authorities. The other way, which is our preference actually, is to work with local partners to support them to take ownership and develop local pride, and it becomes a local project. And that's actually where the links with yourselves, Age Friendly Ireland, has brokered so many important approaches or introductions, and your network is built on collaboration at a local level between the local authorities and advocacy groups and providers of exercise through Sport Ireland and local sports partnerships. And then if we can be introduced and in a way that we can come and help develop the service there, that's the best way to do it. Which leaves aside altogether the online challenge, which is itself interesting for a number of reasons. It's not our comfort zone. It's not what we personally are brilliant at just yet. There's a mixed interest from the participants because what they really miss as a function of pandemic is the social interaction. And reproducing that online is not impossible, but it's a challenge. And we're sort of trying to improve on that as we go along while developing these local centres. And I suppose in Ireland, we have some unique infrastructural partners to work with, particularly, for example, the GAA, which is our national sports organisation, which has a penetration in this country probably a little bit different from other countries, but it allows us to work with them as partners and use their facilities and exploit their own interest in working with the communities, and it builds on their relationships with their players and their players' parents and their relatives. So there's one example of a model which is possibly unique to Ireland, but there may be equivalent models of delivery which would be available in other countries that we'd love to hear about.
Exactly, and I hope through this that we will share those. And Noel, just another question about, I mean, we heard from some people, we've been going here for 15 years, and I know from previous conversations, you don't have to engage. You can do the Exwell program for a while and gateway maybe on to go into the gym or another program. But for example, if I've, 55-year-old, diagnosed with CHF or, COPD, maybe little overweight, or an 80-year-old with rheumatoid arthritis, and, have never been able to get to the gym or go to a physical activity program, how long would that older person need to engage, and what could they anticipate in terms of an outcome?
Well, our model is built on a lifelong relationship. Now, that lifelong relationship may be for 6 weeks now and 2 weeks again next year and 2 weeks the following year, and coming and going and sort of buzzing off to visit your children in Australia or maybe developing a new illness or whatever. So, but I think the really interesting thing is that the benefits occur quickly. I try to stress that. And it really has been amazing to us how quickly they occur. So you will see benefit within 3 to 4 weeks of engaging, and particularly if it's matched with social engagement. Because we did a study on one of our programs about 10 years ago, which showed that taking part in our program over a 12-month period was associated with loads and loads of benefits, as I showed again here today. But the point is that a lot of those benefits occurred in people who attended as infrequently as once a fortnight, which would sort of go against the general advice that you need to train 5 times a week. And it just highlights the importance of the social bit. And our great recollection of those days is people who weren't able to exercise would come along anyway for the cup of tea and the chat and got almost as much from it. It's a really, really important point. And particularly at this time in the pandemic environment where there's been so much loneliness and deconditioning, that they go hand in hand together, really. The social interaction and the physical benefit are equally important.
think that's really, really pertinent, because you mentioned something earlier, and I might ask Pat just about this in the context of Exwell. Noel talked about the carers. And we know the Alzheimer's Society don't just support older people and people with dementia, they very much support the families and the carers. And is there a role for, you know, looking at the physical and social determinants of health for our carers? Because if the carers aren't there, as you know yourself, Pat, so is that something that we should be looking more at as well, you know, the roles of, particularly for those with people with dementia, because we know it can be a struggle, Pat.
Absolutely, Catherine, and I think we forget that, you know, many people who receive a home care service or a home help service, it may be an hour a day, it could be a half an hour a day, but the carer is with somebody 24 hours, and particularly if they have Alzheimer's or a form of dementia, they may have very different sleep patterns, etc. So the carer takes on very, very heavy burdens, and research that we've shown with spousal carers shows that their own health may not be good, and they may, 75% of them, in fact, have 2 or more comorbidities. So that's a real difficulty for them. And during lockdown, what carers said to us is that, you know, they found that their loved one became more withdrawn, more isolated, and even the lack of an ability to go out and exercise was a key issue. And, you know, sometimes people don't realise just how much fun there is in daycare centres, you know, and people interacting with each other. And what Noel says is absolutely right in relation to that. I've seen it, and the goodwill and the activity. And if you go on let's say a bus that brings people to or from a daycare centre, the fun and the crack, as we call it in Ireland, that's on that bus, it's their new family. And that social interaction and the physical activity are so important even at that stage of dementia. But there is also the benefit potentially of living well physically, and a healthy mind and a healthy body in actually preventing dementia, and a lot more is known about that now.
Absolutely, couldn't agree more. Alice, we just had a question in about the parking space. Is a very practical question, and the question is, are they only in hospitals? So you have the answer for that.
Yeah, I know in the primary care centres it's become one of the real welcome additions to our primary care centres as well, because you know when you're rushing to an appointment, and as an older person it can be quite difficult to find a space. So yeah, it's become very successful along with the primary care centres. But through the age-friendly county city programme, we have them in all the towns and villages now across the country. So I know they're becoming very successful for older people, which is great.
Count in a long time, but we
haven't.
know that.
No, we're due a count.
Yeah, and again, like that, there's a great template for people who want to.
Oh, absolutely, yes, and they're very important. And they are complementary spaces. And I suppose what's very interesting is that people are starting to acknowledge, and it's helping with ageism, Catherine.
Absolutely.
Insofar as people are starting to respect older people again, which is
another strategic goal of the WHO.
Absolutely, absolutely. Yes.
Emer, there's a question, a very practical question about citizens' information boards and information going online as opposed to face-to-face services. Just as the national manager in terms of, yes, digital and the way we've had to respond, but maybe you'll just talk to me a little bit about the importance of diversity in communications.
Absolutely. I mean, the local age-friendly programmes across the country would often do local directories of service as a printed kind of a handbook to give to older people, but there would be a range of methods for providing information and communication to older people, along with the online, but things like drop-in centres where people can come in and, you know, hear a talk from their local citizens information service, or hear a talk from a local solicitor or something like that. The newsletter that goes out, we have our own national one from the Age Friendly Shared Service, and there are also local ones that are distributed through the local age friendly programmes. Again, they can be sent out in hard copy in the post, as well as digitally as well. So there was a huge focus last year, I suppose, with the start of the pandemic in terms of upskilling older people and providing training opportunities to help them to get online. And indeed some of the local programmes provided tablets or smartphones to the older people, and the NGO sector was very active in terms of providing training as well. So I guess you need a range of methods. There isn't going to be one method that suits everybody. And they complement each other. So, you know, to have the hard copy is great. A little fridge magnet with a phone number or a little bookmark that reminds you to bring your library book back. You do need the range of communication methods too.
That's really important. And, you know, we will be doing the domain on information and communication. And When we started this process 12 years ago, it was actually up there in the top 3 priorities about access, because we have literacy issues in this country, you know, from early school leavers, rural communities. It was a huge challenge. We've done hugely well in the last 20 months, but we can never forget that, you know, people need a range of accesses, and that we can't just use the digital. Asma, can I ask you just, one of the things that's come in, and it was one I was interested in myself, was the mobile clinics. Maybe just could you spend a minute or two telling us a little bit more of that?
Okay. This is the mobile clinic. Actually, it is initiated between Sharjah Social Services Department and University of Sharjah, Faculty of Medicine. So it is a collaboration between these 2 organizations. They thought that good to provide the service where the elderly located. So what was decided that this mobile clinic will be moving toward the cities itself, and it will be allocated in one place, and if you have an elderly, then it will visit you in your house. So in that actually mobile clinic, we have mini lab, we have diagnostic test, and mainly actually also they will have a dentist and a nurse, so they can do a checkup for the elderly, dental checkup, plus some of the blood lab investigation. And this is the concept of it, to reach to the elderly, especially some places like in the mountain and far also. So it is very difficult to bring the elderly, so they will go to the elderly and try to do some of the checkup, medical checkup, and dental services.
There's a lot of information in that, Asma, and I think it's you know, when you're given that level of acute care in the home, that's quite novel. It's something that we could be very, very interested in. It really is keeping people away from the acute setting, so very, very interesting. Thank you for that, Asma. And as we know, when things settle, we do want to bring you over to Ireland physically, and we will hopefully do a site visit. We're not sure when that will be yet, with the way, unfortunately, the pandemic is, but we look forward to having you, Asma. We're going to, we're just slightly over time, but before we get our final message from Kitty, who's our national network, I'm going to give everybody an opportunity just at the end to maybe talk a little bit about their website address and their Twitter handle and that, just to give the contact information, because there's a lot of questions today. Noel, just one very, very quick one, and I think we can probably answer it. Anything planned for working with local sports councils? That may mean sports partnerships, which you're doing already. Would you think that's what that question relates to?
Oh, very much so. We're in the middle of discussions with the Dublin City Council and the 4 Dublins actually around that particular thing, and also around the active cities concept, and trying to link with that and maybe claim, or not claim, but develop a model of active cities programs that reflects particularly the niche area of chronic illness, which would be a very valuable contribution to the worldwide active cities concept, we think.
And I think we know that you've met with programme managers and that you've worked very closely, and I know Westmeath, for example, the sports partnership and that have been looking at their settings. There's so many ways at which can be delivered, you know what I mean, and modest resources. So I think when people, if they want any more information, they can contact the Exwell Program directly. Asma, just a very final quick one before we go to Kitty's address. Is the age-friendly programme being rolled out in any of the other Emirates as yet?
No, not yet, but really we have a vision to expand the program so it can include more Emirates. But till now, Sharjah city is the only Arabic city part of the global network. But really we want to expand the program. Sure, our future plan.
And then the other Emirates can learn from you, Asma.
Thank you.
Before we go to closing remarks, we have a very important Christmas message. As you know, Kitty Hughes is the chairperson of our national network of older people's councils. As we said earlier, the voice of older people is the foundation on which the Age Friendly Ireland programme is built. Everything we do is designed and by older people, for older people and with older people. So we're delighted that our Christmas message has been brought to you by Kitty today. Thank you.
Acahirlach, Minister Mary Butler, friends in Ireland and globally. It is my pleasant duty to bring you Christmas greetings on behalf of the National Network of Older People's Councils in Ireland. Christmas is a time when we are surrounded with the love of family and the camaraderie of friends. It is a time to reflect and acknowledge the challenges and achievements of the past year. I want to recognise and say a special thank you to all who rose to these challenges with empathy and generosity. The community call volunteers who answered requests for assistance and with shopping and delivering necessities to our homes. The friendly postmen and women who checked that all was well when they were on their rounds. The volunteers answering helplines, the library staff who sent books, and above all, the valour of our healthcare workers who day and daily battled to save lives, cared for and comforted those suffering from COVID. Thank you for your dedication to duty through it all. Thank you indeed to Catherine and staff at Age Friendly Ireland for leading us with vision and empathy, listening to different perspectives and saying yes to challenging opportunities so Ireland will be a better place in which to grow old. I'm sure in time to come, this year will be known as the year of the vaccine, the year when scientists offered solutions and older people led the queue for vaccination, and with it, a chance to return to normal life. Indeed, the often quoted lines of Seamus Heaney might, after all, be true. If we can winter this out, we can summer anywhere. Oh, we summered at home. We vacationed in Dingle and Donegal. We welcomed family and visitors into our homes. We met new grandchildren, had coffee with a friend. And the voice of older people was heard and heeded once more. We honed our digital skills during the lockdown, and now we're ably debating issues and holding meetings local and national, working out solutions with Age Friendly Ireland and a honeycomb of faces on screen, talking of housing and transport policies. And internationally, we participated in the World Health Organization webinars on combating aging and ageism. Town hall discussions with Canada were held on healthcare and neighbourhood walkability. And today we're going global. We had wonderful presentations from Alzheimer's Ireland and Exwell Medicine. And we heard about age-friendly guidelines for our hospitals and primary care centres. We can Zoom with the best of them now. Lately, there have been worrying news that a new variant had been detected. Maybe it's a hint that we need to share vaccines with those who have none. We want to say thank you to all who have donated to the work of the World Health Organization in providing vaccines in places where it is scarce. Thank you to all who rallied together to provide the necessary support and assistance to those who needed it most. We say thank you to the volunteers, the virologists, the vaccinators, the vaccine makers, the virtual friends we met on screen. Being older is slowly being recognised as being able, venerable, a valuable contributor to family and community life. And sadly too, this Christmas, there will be vacant chairs at the table and a heartache that goes on and on. But you are among friends, and we thank those who were that friend to each of us during the past year. When we light the candle at the window this Christmas, we will remember all of you. May you have a joyful Christmas among family and friends, and may the new year bring good health and new opportunities to make life better for all of us. And I'll finish with the words of our poet who passed away this year, Brendan Kennelly, from his poem, Begin. Though we live in a world that dreams of ending, that always seems about to give in, something that will not acknowledge conclusion, insists that we forever begin. Happy Christmas, everyone. Agus go méid bio an amseo a ríis.
Thank you, Kitty. I think that was fabulous and just summed up everything for us today. So before I just give the closing remarks, Asma, could I just ask you if there's any website or people can be directed to for further information, just to close off? Can you give us the information?
Yes, we have, and I will share it with you. It's I don't know it. I have to write it for you. I will email it to you.
We'll put it up on social media and we'll circulate it to all the delegates that came today. So thank you for that, Asma. Noel, can you share your details just for our online viewers?
Thank you, Catherine. Our website is www.exwell.ie, and any inquiries to info@exwell.ie.
That's great. Thank you, Noel. Pat?
Yeah, www.alzheimer.ie. A lot of information, a lot of resources, and developed in conjunction with people who have dementia and carers.
And we know an awful lot more of our older people are using Facebook and Twitter and that, so we can share all those addresses as well. I think it's really important that we're giving them, because there's a lot of families as well that might be interested too. And Emer and Alice?
Websites are agefriendlyireland.ie and agefriendlyhomes.ie. So if you go onto either of those, you'll get contact details for the programme staff and our range of initiatives.
And Alice, you'd agree a lot of the older people are using our Facebook and our YouTube and all of those channels as well.
It's wonderful to see it.
Fantastic.
But we should never forget the ones who can't use it.
Exactly. They're the more traditional methods, and that's really important too. So thank you. I just want to say very, very quickly, I'd like to thank Belinda in the Solstice Theatre here for the use of the building, as always, and our colleagues in Meath County Council Corporate, who are so wonderful. I'd like to thank Sylvia and Anne, who, without their input, this wouldn't run the way it is today. And hopefully next year, when we have our new schedule, that maybe we'll start be able to get back to a little bit more physical interaction. Our next webinar, our third in the series, is scheduled for Tuesday, the 11th of January. So we're looking much forward to welcoming all our online viewers. As we say, we have tweeted, but we'll be setting up the link if anybody wants to watch this back, and we'll share all the contact details. So without further ado, I'd like to give my final thanks to, first of all, our Cahorlach and Minister Butler and Stephanie, who came in remotely. I'd like to thank Asma. I'd like to thank you, Noel, for being here today, and you, Pat, for being with us, and Emer and Alice. So thank you, everybody, and we look forward to seeing you next time. Happy Christmas.